the public, which is great news. And our hospitalizations are now under 500, which is the first time that's happened since September. And so our doctors are seeing fewer cases of COVID coming into the hospital. The number is 468. Today was a really low new case day of COVID. We had only 111 new cases, which I believe we haven't seen that number since August. Another great bit of news. As far as vaccine hesitancy, Kaiser Family Foundation just released a new survey that said that the number of those were a little hesitant in the wait and see category, actually decreased from 31% to 22% from January to February. That's good news. And there's a persistent 1 in 5 that say they're only going to get the vaccine if they're required to do that because of school or work reasons. We still have just one variant in Oklahoma, the P1 or Brazilian variant. We've just had one case of that, so we've been lucky. The B117 or UK variant's been found in 46 states or jurisdictions. The B1351 or South African variant has been found in 16 states. And the P1 or Brazilian variant has been found in 5 states. And Houston is now the first city to have all 3 variants identified in their city. With that, just a housekeeping feature, you all should have permission to record this Zoom conference, but if not, please use the raise hand or the chat function and ask for permission, and we'll certainly grant that. With that, I'm going to introduce one of our regulars, Dr. Kendrick, David Kendrick, who is the founder and CEO of My Health Access Network. He's also the department chair of the Medical Informatics Department, OU School of Community Medicine. And he's going to talk to us today about the My Health COVID-19 trends. Dr. Kendrick, thanks for joining us.
Thanks, Dr. Monks. As Dr. Monks indicates, let me just share my screen here. We have pretty good news to share, at least from the perspective of the data in My Health. Just a bit of background, My Health is the nonprofit health information exchange in Oklahoma. We receive data in near real time from the laboratories across the state that conduct COVID-19 testing. We have over 350 different flavors of COVID-19 tests we've received over time. With different labels and so on, and we clean those up and put those out in this report. What you're looking at on screen now is the 7-day moving average there in the orange line of positivity, and each of the blue bars is the daily score of positivity. And I don't tend to use the current day because it hasn't finished yet. We're looking at yesterday statewide. We were at 7.3% positivity per the data in My Health. So that's a pretty good sign. And if we look at some specific geographies, I'm usually asked about Tulsa and Oklahoma City. So in Tulsa is finally below 10% at 8.6% positivity. Oklahoma City is below 5%, 4.41% in the numbers that we have in My Health. Another curve I like to look at is the count of actively infectious patients. And this is basically saying who's had a positive test within the last 14 days. Don't look at the absolute number because we don't get all the tests in the state. We get a majority, but not all of them. But if you look across here, you can see that we're at about late June numbers again in COVID-19 in terms of looking at the whole pandemic. But I think it's helpful to see, where we've been. And I can remember there was a lot of panic back here in April, and look where we got to in December and January.